the fertility journey is a very difficult journey for most people. I think it really threatens people's idea that they will become a parent. I'm a big fan of what I call authentic hope, which means hope grounded in science. Every single person's combination of factors for authentic hope is going to look a little bit different. There are no two identical fertility journeys. It just doesn't exist. I think every person has a fertile zone, right? So it needs to be individualized. If somebody's been pregnant before in a certain way, I always take that into account. Most people, when they see me, are at a heavier weight than when they conceived before. It's just the way that time goes. But not everybody. And I think that we have to be careful not to equate health and weight because they are different. I always tell my patients and my clients, I'm like, there's going to be bad news, there's going to be good news, but we need to find a way to stay grounded. We need to find a way to access our breath. It's not just about losing weight. It's about, changing like food as medicine. It's about intuitive eating. It's about making sure that our bodies now are the kinds of bodies that are going to deliver babies and beyond.
I have Dr. Erica Bove here. She is a double board certified gynecologist, OBGYN, and a reproductive endocrinologist physician at the University of Vermont. She's also the CEO and founder of Love and Science, Thriving Through Infertility, which is an amazing fertility coaching program where she heals the healers on their fertility journeys. This is such an amazing field of medicine that you've combined, and we're very, very excited to learn more about fertility coaching, Dr. Bove. So welcome.
Thank you, Dr. Makhija. It's such an honor to be here.
So the way we do this, Dr. Bove, is we'll have some rapid fire questions for our audience, break some myths, and then we'll go into a deeper dive about fertility coaching and some transformational stories that you have for us.
Absolutely.
True or false, if you're healthy and under 35, fertility isn't something to worry about.
False.
Number 2, does IVF always guarantee pregnancy?
No.
Number 3, if you're not ovulating regularly, there's no way to get pregnant. Myth or fact?
Qualified answer. You have to ovulate to conceive. So I would say that is a fact, although there's things we can do to help.
Number 4, do emotions and stress have zero effect on fertility?
No.
Number 5, you should only consider a fertility coach after seeing a doctor. True or false?
False.
Okay, thank you very much. So now all these questions are going to be answered with great insights from you. So before I get into the questions, if you can elaborate or just tell us what exactly a fertility coach does, what are you doing, and what does it entail?
Absolutely. So the fertility journey is a very difficult journey for most people. I think it really threatens people's idea that they will become a parent. And for many people, that's their number one focus in life, is that at some point they would become a parent. And it comes with all of these emotions: hopelessness, despair, fear, anxiety, sadness, grief. When it works, it's wonderful, but usually there's a journey to get to that point and an acceptance that maybe it might not happen, which can not just affect the individual, but can affect relationships too. So what a fertility coach does is, coaching essentially shows people that they have the answers inside them. However, they need a guide to help shine a light on their thoughts and feelings. And then sort of we brainstorm together, are these thoughts and feelings that are existing now, are those serving you in terms of how you're showing up? And if they're not, then we brainstorm, okay, what could this look like if you had a slightly different thought, a slightly different feeling? How would that affect your actions and inactions? And how would that actually change your results in the world? And so, I'll tell you, sometimes we talk about fertility, which is probably the bulk of what we talk about. However, it's just the access point. Sometimes we talk about work boundaries. Sometimes we talk about family relationships. And what coaching does is it really up-levels people's experience of life. So what coaching does, and in my perspective as a fertility physician and a fertility coach, is I provide the science and the scientific empowerment, right, alongside the emotional support to help people cross the bridge to parenthood whole, intact, loved, and supported.
That's impressive. So yes, combining the love and science, just the way your actual website and your podcast talks about. Okay. So in, for women, right? So how does women's psychological well-being, I think this also goes through a rapid fire question. So could be stress, self-doubt, grief, or inability to conceive in prior attempts affect her future fertility journey, and how is coaching contributing to her success, her support for the future?
So I think everybody has a certain point in their fertility journey. Some people are very early in their journey and they're still trying to figure out answers. Other people have had some treatments and they haven't worked. I will tell you, most people who are on the fertility journey, if they stick with it, will ultimately have success. Maybe people will need more involved technologies like IVF. Sometimes people even, might consider third-party reproduction, which brings in another person into the equation. However, most people who stick with it will ultimately become a parent. However, there is a significantly high dropout rate because it is just so incredibly hard. Like I said, it's hard on the individual, it's hard on the self-concept, it's hard to maintain the rest of life, it's hard on relationships, if that's pertinent. And so I think what happens is that people get this idea that it's never going to work for them, or it's too hard, or it's too expensive, or even just the isolation, like I'm doing this alone, or it's driving a wedge in my marriage. And that really can set somebody up to stop trying, to become hopeless, to really not believe in themselves in the process. And so, I'm a big fan of what I call authentic hope, which means hope grounded in science. Wherever somebody is at in the journey, I say, okay, what factors are in your particular story, which, really would suggest that it makes sense to keep going. So maybe somebody has a young age and therefore likely has good egg quality. Maybe somebody has a good ovarian reserve on paper. So maybe they're 38, but they have a lot of eggs left. Maybe somebody's had a child before. That's always a good factor in terms of knowing that things have worked before. Maybe somebody hasn't yet had success with IVF, but they have a lot of good embryos in the freezer. And so every single person's combination of factors for authentic hope is going to look a little bit different. There are no two identical fertility journeys. It just doesn't exist. But my job as a coach, as a fertility specialist and a coach, is to shine a light on, okay, where are you in your journey? What have you tried? What are your factors for authentic hope? And how can we put together a plan, obviously in conjunction with the fertility specialist from a scientific standpoint in terms of therapeutic next steps, but mindset to have possibility thinking? Because again, people get so shut down by this process that they believe it's impossible. And then the actions and results tend to flow from that because people miss their appointments, they miss their meds. Maybe they decide not to continue. And then that hopelessness becomes a self-fulfilling prophecy.
That brings me to a question which I didn't have in our interview question, but this is what I commonly encounter is when they've received their fertility treatments, they have conceived, and after the postpartum period, the number of injections or the medical therapy and everything else that they're going through, and then the hormonal fluctuations in the postpartum period is very, very distressful. So how are you helping these women to prep, like say if when they're going through, so it's not just before, right? So it's probably before, during, and after the entire
Absolutely.
journey.
Yeah. It's so interesting that you bring that up because I think a lot of my patients, a lot of my clients say, I just have to get pregnant, then everything is going to get better. I just have to get pregnant. I will tell you, invariably, once somebody does finally get pregnant and they're looking at the data, they're looking at the hormones, the anxiety increases, it doesn't decrease. It's like, well, what if I have a miscarriage and how am I going to be a good parent? And, all the different anxieties that come up, oh my goodness, I have a virus. Is that going to destroy everything? Right? Like, it's almost like, I say, get ready because yes, this is the desired outcome. However, it's a whole new set of anxieties and fears are going to be unleashed. And so we need to be on top of it. And just for background, there's data that people with infertility have comparable anxiety and depression rates to people with cancer because it's such a threatening diagnosis. And so I always tell people, hey, I'm a double board certified OBGYN and REI. I will work with you throughout your entire pregnancy and beyond if that would serve you. And there's many people who do my 3-month program and maybe they've even done a couple months of the membership, but they get pregnant and they're like, hey, I'd really like to continue working with you. I talked with somebody just last night about this. Like, let's do a couple sessions a month just because this is such a stressful time. And, I'll support people as long as they want and need support. I'm also looking into, this doesn't exist yet, but it will soon, a support group for newly pregnant people so that people can continue to meet in a group setting if they want to as they're pregnant, because I really do believe that a lot of the healing comes from the group itself. And so that when people can understand that they're not alone with their anxieties and fears and hormone shifts and everything, it can be very normalizing and people can really brainstorm together with me as a guide to figure out solutions to their own problems.
Yeah, I love the community support because then you feel you're not the only one in this journey.
Yeah.
Yeah. So
It's tough. I will say, oh, go ahead. Well, just that there's people who meet with me and they're like, oh, I don't do groups. I'm an introvert. I don't do groups. Like, I'd rather just go this alone. And I would just, if you are, I'm an introvert. I have received the power of the groups, and that's part of why I am passionate about this mission and keep going. Just give it a try. Just lean into it because, even if you don't say much, when you see your story reflected in another person, or you see how somebody navigates a situation that might help you, there's tremendous power in that and tremendous support. So even if you're like not a group person in air quotes, we don't know what we don't know. And there's so much healing and support that can happen. And just my suggestion is just to be open to it because it adds a whole other dimension to the experience that, even in my one-on-ones, I can't create.
Yes, yes. The human connection and the healing.
Yeah.
That's
Yes.
important. Yes. You talked about mindset, right? So what are these mindset shifts specifically, the patient population or the clients that you are interacting with, what are their emotional breakthroughs that when they come out at the other end, it's like a wow effect.
Yeah, I can see it happening. It's
Yeah.
really amazing. Like I can feel the energy when I coach people. And so just to give a couple of patient examples, because I think that maybe is the most powerful. So I saw this woman from California actually, and she came to me saying, "Hey, Dr. Bove, I've had two losses, before I did IVF, and they told me that IVF was gonna fix my problems, but unfortunately, I did IVF. I've now had two embryo transfers, and unfortunately, I had a pregnancy, a non-pregnancy cycle where I didn't get pregnant from the embryo transfer. And then I had another miscarriage. And even though I have embryos left, I'm telling you, I just can't see that it's possible that any of these embryos will work. And I need you to help me get over myself so I can believe in this process again." I think when people get bad news over and over again, they really can shut down and it's really hard to believe because it hurts so badly, right? It's so hard to believe that this can happen. So she came to me saying, "I have a limiting belief. Can you help me get over this limiting belief? Because I want a pregnancy. I want to believe this is possible." And she really didn't believe it was possible. So, we in coaching, we sort of uncover, okay, well, why, where does that come from? Does it come from just the bad news? Does it come from another experience where maybe you were told that something wasn't possible? Where is it because it hurt so badly the first and second time with all the bad news that it's just too painful to go to that place? So we have different tools. We have emotional regulation where we, as a discipline, feel our feelings 3 times a day, which I know sounds kind of wild, but if I'm afraid of shame, I'm going to do anything in my power to avoid that feeling. But if I can say, shame is just part of the human experience, it's part of the 50-50 of life and human emotions. If I can learn to tolerate shame as part of the landscape of my inner experience, when shame comes along, I'm going to say, "Oh, hi, old friend. I recognize you. Thanks for being here. I think I'm good." You can sort of pipe down, but it's not such a big thing. It's the same thing when we have these crucial, difficult conversations with other humans, right? I always say, start with yourself first, tolerate the emotions. But when we're having an uncomfortable situation with someone we really care about, if something comes up like sadness or disappointment or maybe fear, we can notice the fear and tolerate it in the context of a conversation and keep going instead of shutting down. So with this person, I really said, okay, well, where is this coming from? It is more likely than not that this next embryo transfer is going to work. How can we help your mindset to really believe in possibility thinking? And I'll never forget, it was around week 8 when she said, "I can feel it. It's possible that this next transfer will work." And I would say you don't have to believe with 100% certainty, but you just have to crack that door open to the possibility because otherwise everything shuts down. And I truly believe our vibrational frequency is lower when we are shut down and we don't believe. Again, not just believing for the sake of believing, being like, you have tested embryos that are fantastic. You've been pregnant before. Like there's reasons to believe, but helping people make that shift to believe themselves. And then lo and behold, of course, the next embryo transfer worked and we navigated the whole range of emotions and she delivered a beautiful baby boy in November. She's a mom and she's thinking about building her family. So that's sort of one example of like the work that happens where, it's like impossible in someone's brain. And then with work and time, it does become possible.
Yeah.
Another example, and I just worked with somebody very recently about this, is, when somebody's experiencing the fertility journey, it is like front and center. It's like all the only thing in people's field of view, right? And so I say, okay, let's understand why that is. Let's say, there's more to life than the fertility journey. Let's put it back in perspective. Say we're thinking about a house. It is a room in your house. It is not the whole house, right? And so I really work with people to understand, okay, what are their values? What are their priorities? What brings them joy? And we infuse joy and self-compassion into daily life such that the fertility journey, yes, it's important. Yes, we do the things that have to get done to get the appointments done, but we know that there's more to life than this. And so then we can feel like human whole people undergoing the process. So it's like fertility doesn't need to take everything. We can have a full life while we're undergoing this process. It's still hard, but it's not the only thing driving the show. And that's another mindset shift that I think really does help people, is that sense of perspective, so that they feel more in the driver's seat than just, I'm waiting for the next test result. I'm waiting for the next, imaging study, whatever it is, to kind of show me my worth. We're like, no, where does your worth come from? What brings you joy? What brings you life? What's important to you outside of this journey? And then the fertility journey almost happens in the background.
Impressive. So you're empowering them with all the tools that you have, right?
Yes.
And the possibility thinking, not having those limiting beliefs, not just by not having it, but the coaching is actually training on how to shift from this style of thinking versus this style. And I love the authentic hope that it's so individualized. We call about personalized care. We talk about individualized thinking and how our lives are. But you are just, I love this term, authentic hope. It has to be for you. Very, very impressive. So, with women, right, we talk about women's health, and they're the ones going, and when this is a very big myth or common myth that infertility is equal to just women's health or something wrong there. So would fertility coaching, or are you providing that, would that be a great one for couples or partners or both of them?
Absolutely. I'm so glad you asked that question. I love working with couples. And, it's interesting. A lot of male factor infertility. So, like, just to back up, 40% of couples who see me who are heterosexual couples, 40% of those couples will have at least some element of male factor infertility. And I know you know this as an endocrinologist. Like, we know when men have low testosterone, if that's part of the equation, that has other effects on their whole health picture, right? Their mental health, their physical health, their muscles, their bones. Even I say to the men, I care about your bones. Let's get you to see, reproductive urologist who can, I start the laboratory evaluation, but then a lot of times these men end up even just feeling better on a day-to-day basis as their sperm is getting better. A lot of times, there's actually, we always say, what can we control? What can't we control? We can't control the age of the woman or the couple. That's sort of its own variable. However, I will tell you, a lot of times when I take it through our history, there's behaviors. Of course, we have stressful lives. We are, treating our stressful lives with substances and such. Many, many, many of my, of my husbands, I will say it that way, or male partners, are chewing tobacco, which is even worse than cigarette smoking, right? Or they're smoking cigarettes and they're trying to quit but haven't been able to yet. Or I practice in Vermont, which is, marijuana is fast and free. I'd say at least a third of my, couples, there's some marijuana involved. And we know that, it sounds funny to talk about, but I say, your sperm are stoned, sir, your sperm are stoned. Like, they swim in circles. Like, we need to get your sperm where they are not stoned anymore and they can actually move in the right direction. And you'll see it, any lifestyle change that these men make, it'll take about 3 months to see the effect, because that's how long a new sperm takes to travel in the male reproductive tract. But, it is really interesting when we think about, it's not just the woman and her habits and her lifestyle and her ovulation and her anatomy. A big component of this is, making sure that everything's optimized on the male side as well, which isn't just about the sperm. It's about in this holistic approach to their lives. I'm sure you understand this too as an endocrinologist. When I get those labs, I'm like, oh, wow, sir, you are profoundly hypothyroid, or oh my goodness, you have type 2 diabetes and your A1C is 13. We need to get that down. I saw a man recently with acromegaly, and that was really affecting his whole axis. And so I think there's a lot that we can understand about whole health with the fertility journey. My ophthalmologist friend says when she looks into somebody's eyes, she can learn so much about their cardiovascular system. It's kind of the same thing with fertility. Like, that's the access point. And when something's off in the body, sometimes that's the first sign that we need to look deeper.
So amazing. So this also actually elaborates on one of our questions, our rapid fire questions about, how if stress can impact infertility, and it's in both genders.
Yeah, I think the hard part is it's really hard to study. And so, we've looked at acupuncture studies and we've looked at other, but stress is really hard to measure. Everybody has their own threshold. And how do you standardize stress scales and all those things? We know, I always say, my mentor would say, is it biologically plausible, right? So, like, we know that when we're stressed out, what happens? The adrenals are on overdrive. We know that there's increased cortisol. We know that that affects, insulin pathways and ovulation pathways. And when we're super stressed, sometimes our ovulation entirely shuts down, right? But I think we also need to think about egg health and the whole menstrual cycle and IVF outcomes and everything. Because at the end of the day, what we're trying to do is simulate a normal embryo, a normal menstrual cycle. which ultimately results in an embryo that will implant inside the uterus. And so if that's a stressed out environment with high cortisol, we've all seen it when people are super stressed. Oftentimes the treatments don't work as well. And it really feels crummy to undergo that experience. And so, from a biological standpoint and a quality of life standpoint, how can we help people navigate this journey in a way that, is not so stressful, that they trust the overall process? I say, hey, you are in the middle of this cycle. Your whole journey does not ride on the cycle. So let's trust the process, see what we can do in the cycle, see what we can learn, and let me take the burden from you so that you don't have to be, hypervigilant, going down the Google rabbit hole, all those things, because that in and of itself is a harmful thing in and of itself. So I think as physicians, we can guide our patients and our clients in a way that empowers them, because it's like, we will distill the knowledge. We will share this with you in a way that is relevant and ultimately helps your journey. Like, you don't have to worry as much because you're in good hands.
Absolutely. Yes. This was so powerful and empowering. Yes. And what I love that you're doing, you may just think that, oh, there is a fertility specialist, there is, reproductive endocrinologist, there's a fertility coach, but every individual, as yourself, they are looking at the whole picture. So the coaching cannot happen if you're just focused on one organ or just one symptom. But you're looking at the behaviors. I'm sure you're looking at the relationships and
Yeah.
the mind,
Sleep,
sleep.
everything.
So give me or give our audience an example, like, say a woman's life, right? So her health, her hope, her outlook is being transformed. So in your experience now with coaching as well as being a reproductive endocrinologist, how does a woman or how does a couple decide that, that they should seek fertility coaching? Well, wait
Good
for a
question.
long course of
Yes.
struggles and frustrations, and then at the end deciding that, okay, I wish I could have done this, a few years ago.
So, if a couple has been trying to conceive for over 12 months and the woman is under the age of 35, that's an automatic referral to a fertility specialist. Or if somebody is, the woman's 35 or over, that actually gets shortened to 6 months, because we know that those women have, egg quality issues sometimes. And so, seeing a fertility specialist sooner to get the evaluation going and get some answers is helpful. Now, if somebody has risk factors in their history that would make it more likely that somebody would have infertility, I say, please don't wait that amount of time. Just go and get checked out. Like, for instance, say somebody doesn't have regular periods and we think maybe they're ovulating a couple times a year. That's not a fair shot at pregnancy. So go see somebody sooner to see if something can be done about that. Maybe you've had multiple abdominal surgeries or you've had a pelvic infection in college, and all those things can really affect the fallopian tubes. And so go see somebody sooner, get your tubes checked, and really make sense, see if there even is the possibility that when you're with your partner, the sperm and the egg have a chance to meet. Or I've seen, people with a history of cancer and chemotherapy, which, as we know, can affect egg and sperm. So, this is where I think we need to have, again, personalized medicine to say, oh, you and your situation, you might have more, a higher chance of infertility than somebody else your age. So go get checked out sooner. We're always happy to have that conversation. Now, I also think that there's this other population of people, we're seeing deferred childbearing and, women in the workforce, which is such a positive thing. We have not caught up with education about women's bodies. And so, like in one of your rapid fire questions, is it all going to work out if you're under the age of 35? Like, actually, not always, like maybe you're 33 and you were dealt bad genes. And despite your best efforts, you find yourself with, no eggs at the age of 33. Like, if fertility and family building is a priority for you, see somebody even in your 20s. We can freeze eggs. Even though there's no fertility test per se, a screening test can't say, yes, you're going to be able to have kids, no problem, or not. We can at least understand if your ovarian reserve is appropriate for your age, and if there's anything else we need to worry about. So, if you are single and you really, or even just in a partnership and you're not sure that this is a priority for your partner, but it is for you, please go see somebody, because there's so much we can do on the earlier side. And then, as we know, 5, 10, 15 years goes by very quickly, and that can make the difference of this being able to happen or not sometimes.
So, so true. So, one of the discussions that we had was in one of our previous interviews with regarding self-advocacy, but also physician and patient advocacy together, shared decision making, prevention, screening. So you touched all those points so beautifully about the age for seeking care, right? And seeking expertise. Phenomenal.
So, and if you're 40, say you meet the love of your life at 40 and you really want a baby, I would argue don't even try 6 months. Just go see somebody, because, by the time you get in and get established, I mean, you can try alongside But so often I see people like, in the 40s, every 6 months makes a difference. And so, that's when I would say the most efficient way after 40 to get pregnant is to have some intervention. Not that everybody needs it, but at least get yourself established, get some testing done so that you're in a place where you could have an intervention if you're having problems on your own. You just had to add that in. And coenzyme Q10 is actually evidence-based. That is a supplement. It's an antioxidant that in both animal and human studies has shown that it can help with egg quality. So I'm not a huge supplement person, but that is one that I really do stand behind because there's so much data to support its use.
Okay, so I that takes me to our last question is lifestyle interventions, because you touched points in regards to lifestyle with the coaching aspect of it, but anything that you really talk to or discuss with your patients or your clients about other factors, including if you can elaborate on the supplement that you just mentioned about the science-backed evidence.
Yeah, absolutely. So lifestyle is one of the most important things. And like I said before, there's some things we can control and some things we can't. We actually can control a lot of the aspects of our lifestyle. And if we have a toxic job that is, causing a lot of stress, I think it's really important to evaluate, is this the environment in which I want to bring a child, right? Like we are starting the process now, right? Before we even have the child to say, what kind of a space is this? Maybe there's a lot of marijuana. Maybe there's significant life stress. Maybe there's something standing in the way of, maybe there's alcohol addiction, like whatever it is. Like, I think we have to start looking now to say, like, once I get pregnant and have a baby, is everything going to get better? Or do I need to make changes now that are going to help me evolve into the person I need to be the best parent I can be? And so I think about smoking cessation. I think about chewing tobacco. I think about, marijuana. I think about alcohol use. I think about, we talk about this. I know this is an important part of your practice, like thinking about what is an optimal weight to conceive. And I know this is a very controversial topic. I have lots more to say about it if you ever wanted to talk again about it. I think every person has a fertile zone, right? So it needs to be individualized. If somebody's been pregnant before at a certain weight, I always take that into account. Most people, when they see me, are at a heavier weight than when they conceived before. It's just the way that time goes. But not everybody. And I think that we have to be careful not to equate health and weight because they are different. But there is also some overlap. And we know in population-based studies that people who, have certain BMIs, which again is imperfect, but still, they tend to have better, not just getting pregnant, those outcomes, but also staying pregnant, lower miscarriage rates, lower, risk of birth defects and gestational diabetes, and also higher live birth rates, which at the end of the day is, I say, I don't want to just get you pregnant. I want you to walk home from the hospital with a healthy baby in 10 months. That's my goal, like really more thinking more holistically. So what can we do today, whether it's insulin resistance and getting handle on that? You'll be so proud of me, Dr. Makhija. I got a body scan today. I was so proud of myself for the first time. I was like, this is so cool. Maybe I did it because I knew I was going to see you today. Maybe it's my subconscious was like, you got to do this now. But just getting information about our body composition and sort of, what are ways that we can tweak our own, our own bodies, our own physiology so that they can work optimally so that we can, ovulate well, that we can have better egg quality, that we can receive an embryo. All those things matter. And so working with, doctors who understand these complexities, it's not just about losing weight. It's about, changing like food as medicine. It's about intuitive eating. It's about, making sure that our bodies now are the kinds of bodies that are going to deliver babies and beyond. And so I think for many people, it's really a wake up call to look at the lives holistically and say, okay, how are things going in terms of diet, substances, stress, sleep? And is there anything I can do to optimize my health now that will help with the overall picture? And then, the supplement, like I always recommend that people take folic acid just because that's been shown to reduce the risk of neural tube defects. And so that's really important before you even try to get pregnant. People go all crazy about brands. Don't worry. Don't spend too much money. You don't even need the prenatal vitamin. Just the folic acid will do as long as you have a balanced diet. And then the coenzyme Q10, there's animal and human data that it can help with egg quality. Do you really need it if you're under the age of 35 with normal egg reserve values? Maybe not. But it's specifically for people with, who are a little bit older, trying to conceive and who have diminished ovarian reserve. It's really been shown to, because the eggs are the traffic controllers of the body of the chromosomes. And so they shuttle the chromosomes in different ways as the cells are undergoing their divisions. And so you actually need a lot of egg energy to be able to do that process. And so, if I say if the traffic controllers get tired, they're going to let too many chromosomes go one way or too few chromosomes go another way. And so you really want the mitochondria, which is the energy center in the egg cell, to be as robust as possible. So that's really what's been shown, is that this coenzyme Q10, 200 milligrams 3 times a day, that really does bolster that egg energy, that there seems to be more eggs and better quality eggs when people can do these things.
Yeah, how beautifully worded. So, I gathered the focus that you just emphasized was changing like our internal environment as well as the external environment that we have control of. So, the space that
Exactly.
you really talked about and how we can make that, healthy, blooming, safe, and, based on our real choices. And you really have your patients as well as your clients get deeper, when deeper to the soul, because that's where the real answers come. I just loved what you shared with us, including the behaviors that we may just consider, or this is my habit, this is where my true happiness is, but how it could jeopardize the health goals that they're probably seeking care with you or for you.
Can I say one thing about that? I forgot to mention. So alongside with that is meditation. I always tell my patients and my clients, I'm like, there's going to be bad news, there's going to be good news, but we need to find a way to stay grounded. We need to find a way to access our breath. And so I always recommend for my patients and my clients that they, even just 5 minutes a day, where they start connecting with their breath, sitting with their feelings, no, I recommend it in the morning, because no matter what happens that day, people have that sense of grounding, and maybe even that spiritual sense that all will be well. That's a really important part of calming the nervous system, which I think is a really important part of all of this. And so as we think about up-leveling the mindset, tools for nervous system regulation, I mean, we have data that meditation lowers blood pressure and all these things. I think that's a crucial part of all of this, is to find that grounding and create that space for yourself every single day, so that the rest of the things don't rock you as much.
Yeah, I think this was the absolute take home point. Yeah. In my office, it's the same thing. They have to learn the breath work. They have to,
Mhm, mhm.
right? And then there is so much evidence in every aspect. Forget about just thinking about physical health, but every aspect, how breath work, the meditation will really
Absolutely.
bring us back to our true selves.
Exactly. That's what this is. That's
Yes.
absolutely, this is coming back to our true selves.
Yeah, how
Exactly.
empowering
And
this is. So, with this amazing, powerful, insightful discussion, if anyone, probably in the world, right, could seek
yeah.
care, or if they are in this fertility journey, thinking about it, or just gone through it, how can they get in touch with you?
So the most comprehensive place is my website, loveandsciencefertility.com. There, people can book a discovery call with me to see if working together would be a good fit. I offer a lot of value in that first conversation. I also have social, so Instagram, Love and Science Fertility, Facebook, a little bit on LinkedIn as well. And I also have a podcast, Love and Science Fertility, and a newsletter. So if you want to stay in the know, sign up for any of those things. But I think my website is really the best place. And you're right. This has become global. I mean, now, people listen to my podcast on every single continent. I've had, clients from several countries now and continents as well. It's really growing. And I think, it speaks to the fact that for many people, this infertility journey is universal. And
Yes.
I think the more we can connect with each other, the more that we can understand that our struggles are, there's some variations in the themes, but there's so many core themes, and we really can heal together.
Yes, you're bringing everyone together. Oh, thank you so much, Dr. Bove. This was like one of my special interviews that I had.
Oh, thank you, Dr. Mahija. I love our friendship, and I love the work that you're doing as well. And maybe continue to collaborate together.
Absolutely. Thank you.